The human heart, it has one main job, to move blood. Each day, the average heart beats 100,000 times and pumps more than 2,000 gallons of blood, bringing nutrients and oxygen to every cell in the body. But for the more than 5 million people with atrial fibrillation, the most common irregular heart rhythm in the world, a rapid and disorganized heartbeat can be a potentially life-threatening condition.
The normal heartbeat is about 60 to 100 times per minute, and there is one-to-one synchronization between the upper and lower chambers of the heart. During atrial fibrillation, there is total chaotic rhythm coming from the upper chambers. That's why it's called fibrillation. The upper chambers being atrium, where the atria start going at a rate of 600 to 1,000 times per minute.
I first experienced atrial fib in early 2000, as I recall. It shortened my breath, it palpitated, and I felt it especially in the evenings. I always told people that I ran at about 90% as a consequence.
Because the condition prevents blood from being completely pumped out of the heart, it increases a person's risk of stroke by 5 to 7 times.
The biggest danger of atrial fibrillation is risk of stroke due to blood clotting in the left upper chamber, and this is the #1 cause of stroke in women over the age of 70.
Initial treatment for atrial fibrillation includes medication to both control the rhythm of the heart and slow down the heart rate.
The traditional treatments have been reducing the risk of stroke, and secondly, to try to maintain sinus rhythm. However, that part has not been very effective because of the inefficacy of the drugs and the side effects of the drugs we have today.
When medications fail to improve symptoms, a surgical or non-surgical procedure to treat atrial fibrillation is the next step. Catheter ablation has been the most successful.
As we understand more and more the mechanism of atrial fibrillation, we can treat this effectively by a procedure called ablation in many patients by either isolating the trigger sites or also modifying the substrate in patients who are in this rhythm for a long time.
Dr. Jasbir Sra, a board-certified cardiac electrophysiologist at Milwaukee's Aurora St. Luke's Medical Center, says unfortunately, many people are not aware of ablation as a treatment for atrial fibrillation.
As this is a new form of therapy, many people are not aware of catheter ablation for atrial fibrillation. However, with time, more and more people are getting aware because of the work by societies such as Heart Rhythm Society.
I became aware of the ablation procedure probably 5 years ago, but most recently Dr. Sra suggested ablation with another procedure which I underwent in December of last year, and it has kept me pretty much in regular heartbeat since. So I'm very pleased. I'm back working out, I'm back on yoga and body pump and doing the things I like to do.
Aurora Healthcare is a 15-hospital integrated health system that has received multiple national awards for quality. St. Luke's, Aurora's flagship hospital, is a nationally recognized cardiac hospital offering leading experts on cardiac conditions like atrial fibrillation.
This was one of the first electrophysiology departments set up in the Midwest and one of the first 5 or 6 departments in the US in 1977, and we have been at the forefront of treating cardiac arrhythmias ever since that time.
Dr. Sra and his team at St. Luke's Medical Center have adapted their expertise to this minimally invasive technique for patients with atrial fibrillation. In the majority of cases, it has provided improved quality of life and potential cure of their disease. To learn more about the cardiac services available from Aurora Healthcare, visit aurorahealthcare.org.